Good morning and good morning to the judges. And first of all, I would like to pay my respects to everyone here who has come today. Me and my team, we have come up with a business idea called Find Me Doc. And this is our team. My name is Sun Lai Ming. I'm from NUM International College and IFL.
I'm Virika from University of Health Sciences.
I'm Darwin from NUM International College.
And this is our mentor, Miss Ilita. And this is our agenda for today. So for now, I would like to draw your attention to see the inspiring story behind these creations. Personally, this happened to my grandma recently. She fell on the floor and immediately dislocated her arm. So after going to the hospital, we spent half of the day waiting for the doctor, and it turns out he's not specialized in bone. So we have nothing to do but to wait for another day. So after going to the hospital, my grandma, she suffered a lot, and I can still remember vividly how hard is it for her to actually find the right doctor. And not to mention about the COVID-19 situation, which is the current situation that we all are facing, and especially to the elder people. So here are the hypothesized problems that our team have come up with. Firstly, it's a long waiting line. Second, it's hard to find a trustful doctor. Next one, it's risky to wait during this situation, and also hard to find certain medicines. So how can we solve these problems? Our team have come up with a mobile application platforms which called Find Me Doc, and it has several functions as you can see. And later on, my team will further explain about this. So the main purpose behind this creation is because we want to provide a better medical experience to the public so that later on Cambodia will become a society with a healthier citizens.
So this is our journey. First, So first we have our initial idea, and then we got out of the building to test and study our project. And we found out there are many mistakes, many errors, and we have to pivot numerous times in order to end up with our current concept, Find Me Doc. So we got out of the building and interviewed about 30 medical professional and potential customer. Also, we did a virtual questionnaire and received around 110 responses. We even went further and interviewed Mr. Long Sarun, Director of IT Department from Ministry of Civil Service, and Mrs. Long Pisopia, a second-year information technology student from AUPP, to validate our app detail. We also built an interactive prototype so people can play around with. So every time we interviewed people, we asked them to test out the app, and they show great interest in it. We also asked people in our survey how likely are they going to use it if it exists, and we received almost 100 positive responses. So this is our original canvas. Let's go to a key partner. We want to partner with the Ministry of Health of Cambodia, Medical Council and Association, as well as payment solution providers such as Bangloi. This is our original plan. First, we want to link patient to doctor, allow them to book online appointment, hold online consultation, link patient to nurse, allow them to call ambulance, and buy and deliver drug. So we asked people to list common problems while accessing medical care. And we received a lot of responses, but there are 5 popular answers. So had to find reliable doctor, long waiting line, medical expenses high, fear of meeting uncertified medical expert, and ineffective treatment. This means that our hypothesized problem number 1 and 2 proved to be correct. However, problems such as transportation, COVID pandemic, and the last 3, which is related to medication, we didn't receive much vote, which means that it is a problem, but it is not common. So number 3 and 4 is incorrect. So we have no choice but to eliminate those services that doesn't need immediate response. We come up with 2 new features, which is medical discussion forum, where people can talk, discuss, and ask about medical-related topic, and other user can give their opinion, and and our user can receive reliable advice from doctors on our platform. We also wanted to include an online data storage to help doctors keep their record. However, after an interview with Dr. Tet Hong Yuen, founder of Rumchang Dental Hospital, he expressed a deep concern about patient confidentiality because he is not the only one who mentioned this point. Other doctors and medical students that we have interviewed also expressed the same concern because when it comes to medicine, Patient information is very sensitive, and it is a risk that startup like us couldn't afford. So we also change our direction, cross it out, and only focus on linking patient to doctor and our medical discussion forum. For our key resources, we have our software engineer, human resource, financial person, and marketing person. For our propositions, so with the widened toolpath for public user, FindMeDoc is a reliable source of medical information, and it is convenient because it saves time, money, and energy. For doctors, however, it increased their brand awareness.
So this is our customer segmentations. At first, our initial idea, FindMeDoc, mainly focused on customer who's from the cities with a middle age and a good living standard. So in total, we have our potential customer, which is about 1.6 million people. But after discussing with Mr. David from Mekong Strategic Advisor, we realized that we were totally wrong. It's because our problem is that the customer is not the patient, but our customer is the doctor, since they are the one that we actually get the money from. So we pivot our idea from this to that. And right now, FindMeDoc, we mainly concentrate on private physicians such as doctors and dentists who practice their own profession privately. So in total, we have about 6,364 doctors.
So now let's moving on to talk about the customer relations. We want to connect to our customer by our advertisements, promotion, and the last one is medical article and tips in our mobile apps. For our channel, we divide it into two parts. The first part is about the doctor who is our customer, and the second one is the patient who is our users. For doctor, we plan to reach to the doctor by pitch, network referrals, association, and communities. If we're looking at to the patient who is our users, we will reach to the users by our mobile app, which is FindMeDoc, Facebook page, as well as the Instagrams and advertisements. Cost structures here, we have been listed down 5 main cost structures, such as app development and maintenance fee, office supply, rental and utility costs, employee salary. The last one is on marketing. Revenue stream is the last point on our business canvas, and this is the initial idea of our revenue stream. The first one is users and doctor pay monthly subscriptions and in-app ads. After we getting out of the building to interview with about 20 of our potential customers, they all are satisfied with our service, but they don't really happy to pay us as the monthly fee. So we need to eliminate it out from our revenue streams. We also go to meet with the doctor and nurse at Bangchuk Dental Clinics. They all love our business idea, but for the doctor pay monthly subscription, they did not want us to charge from them as like that. So we need to eliminate the doctor pay monthly subscription out from the revenue stream as well. In the next, we go to Praketok Mili Hospital to meet with Dr. Leng Bunthun and Dr. Lon Vithi, as well as the owner of Romchang. And what they suggest us is to charge from the doctor as the commissions. So in overall, the final revenue stream from us is 5% commission rate, which is the suitable number for doctors and also us as the owner. Increase doctor exposure with app and in-app ads for medical suppliers. After we get all of the ideas with the final revenue stream, we go to meet the doctor at Whole Worldwide Health Center and also the nurse at there as well. They all appreciate and agree with our final revenue stream. This is the overall of our final business model canvas. The third part is our futures. In the futures, we plan to grow with our goal by providing the online consultations, medical supply marketplace, health mentors, specialist referral system. We have the solutions, we have the passions, and what we don't have is the support, especially the finance support. FindMeDoc needs your support to exist and grow.
We're innovating and transforming how Cambodia approach medical health system. We do not only help patients, but also help doctors to increase their income as well. And we aim for a healthier society as a whole. With Find Me Doc, help is always on the tip of your finger. Thank you.